Now, Nigeria ranked first in Africa and sixth in the world on the TB burden, with over 170,000 missing TB cases, which have created concern as World Health Organization has urged the Nigerian government to increase efforts to locate the missing tuberculosis cases in the country. The National Coordinator, National Tuberculosis and Leprosy Control Program, Chukwuma Anyake, at the year's pre-World Tuberculosis Day briefing said that more awareness creation, the funding is needed to further reduce a huge number. Benedict Uko has more on this story.
The World Tuberculosis Day is commemorated every March 24th to raise public awareness about the devastating health, social and economic impact of tuberculosis. This year gives an opportunity in funding and treatment of TB with over 170,000 missing cases in Nigeria. The World Health Organization and United States Agency for International Development have called on Nigeria to increase efforts to find the missing tuberculosis cases in the country.
TB control budgets in Nigeria continue to drastically be underfunded. About 69% of the TB budget in 2021 was unfunded. WHO will continue to support Nigeria in developing and implementing guidelines, plans, framework, and strategic documents to end TB epidemic in Nigeria.
We recognize the fact that there are still hundreds of thousands of TB cases that are still going undetected each year. So the 40% gap that we have is still significant. This represents human beings who need to be treated. And so to that extent, USAID continues to support the National TB Program by providing quality TB services to Nigerians across 18 states in the country, with the highest TB burdens and the widest gaps in TB case notification. It's critically important that Nigerians understand the signs and symptoms of this disease. This disease which can be treated, which can be cured, both in children and adults.
The National Coordinator, National Tuberculosis and Leprosy Control Program, Chukwuma Anyake, says more awareness and funding is needed to support program activities towards closing the TB treatment coverage gap.
By the end of 2022, we were able to notify above 285,000 missing cases in Nigeria. And that is 60% of the missing cases. As the number one principle of primary prevention, awareness creation comes in. We need to make much noise, and it shouldn't be just on annual basis. We should try as much as possible to let people know. We have a huge gap of funding, not less than 68%. So we need to put up all measures to make sure that every couple counts.
Also speaking, the Executive Director of KNCV, Bertrand Odume, said efforts are underway to increase domestic resources for the control of TB in Nigeria.
We need more education on TB, more importantly, the symptoms, diagnosis, and treatment. At a 69% funding gap and over-reliance on external donor agencies for funding, sustaining the TB program efforts in Nigeria will continue to remain a challenge. We will, at this year's World TB Day celebration, continue to reach out to governments and private sector operators to galvanize efforts at increasing domestic resources for the control of TB in Nigeria.
One of the TB survivors, Joyce Semba, gave advice on the need for early testing, detecting and treatment of patients.
Yes, we can end TB by getting involved. Not just sitting and talking about TB, talking about funding. No matter the amount of funds we get, if we don't go out there to do the advocacy, it's nothing. I am getting involved today by doing one-on-one advocacy. We should get involved by pushing more human and non-human resources in communities, especially rural communities, where I think the high percentage of people still living with tuberculosis are.
15 Nigerians die each hour due to TB. This year's theme, Yes, We Can End TB, calls for everyone to get involved in the fight to eradicate TB in Nigeria.